This boy's skin has a disease called eczema. If it isn't taken care of, it may get dangerously infected. Infections like this are painful and hard to get rid of.
If you have it, then you know it's not life-threatening, but man, it's a pain. I'm talking about psoriasis and eczema, a chronic condition of the skin.
So psoriasis and eczema look very similar to most people. They're both red scaly plaques. The difference is that, in fact, there's a lot of differences between psoriasis and eczema. Psoriasis only happens in about 5 to 10% of the population, where eczema is much higher. We're talking 50% of the population, maybe more depending on where you are. Psoriasis is considered to be a genetically oriented condition.
My doctor actually had to explain it more to me because I didn't know anything about the condition. I knew a family member had it.
So it runs in families. If you have 2 parents or even 1 parent that has a chance of you having it is a lot higher. Psoriasis plaques are very well demarcated, and they have 3 features. They have redness, scale, and thickness, and they typically happen on certain sites. So we're talking about the elbows, the knees, the scalp, sometimes even genitalia region. These are, the nails can be affected. These are the most common areas of that.
I have it on my leg, I've got it on my elbows, and I had one spot here semi-recently, and I've got it on my scalp. I was so used to having good skin all my life up until I was 18 that it was a hard adjustment.
And unfortunately, psoriasis doesn't really go away. It may burn out over a long period of time, but even under good circumstances where things are moist and humid, you can still have it.
Like most medical conditions, things are getting better. It's always a good idea to keep up on the latest treatments.
This is probably the best time in history to have psoriasis because there's so many things available and our knowledge about psoriasis has increased. Basically, I divide the treatments of psoriasis up into 4 different categories: topical, systemic, meaning pills, injectable, and even light therapy.
Not every treatment works for everyone. The thing that helped me the most was sun tanning. Just because that worked for me doesn't mean that it won't work for others. Just because the creams didn't work for me doesn't mean that won't work for others.
The main thing is to seek the help of a professional.